Everybody, Dr. Dane here, and I'm going to be coming October 20th of 2017 this year to the Greater Columbus Convention Center, and I'm super excited because I'm going to be talking to you guys about something that I think is really relevant, and we call it using physiology and biology instead of symptomatology for your patients. And what do I mean by that? I mean, we can all relate with the fact that people come to us because they're hurting, or people come to us with symptoms. And they get their symptoms corrected because we do a great job as chiropractors through chiropractic care and also modifying their lifestyle. And once their cues, their symptoms go away, what happens to the patient? They normally go away as well. And yet the dental profession has really figured this out because people go see the dentist on a regular basis. They brush and floss, and that keeps them coming back to the dentist to make sure that their biology of their teeth, their physiology of their teeth is functioning well. Now we recognize that we can see our teeth, but what if you started measuring biology and you started measuring physiology instead of focusing on symptomatology with your patients? What if you got your patients to do the same thing? And that's what we do in our practice, and that's what I'm going to be teaching you. We look at 4 categories of a person's biology, their physiology. We look at their neurospinal health. So that would be things like your x-rays, if you use substation scans, or if you're using any type of heart rate variability. Then we look at functional fitness. We do an FMS, a functional movement screen, to look at a person's core strength and their core mobility, right? So how strong is their core and how mobile is their core? We also look at general health parameters in our patients. How about looking at your patient's blood pressure, or their resting pulse, or their amount of visceral fat they have in their body, belly fat, which is pro-inflammatory, right? It produces all kinds of nasty chemicals. So, and then the last thing that we look at, guys, in addition to their neurospinal health, their functional fitness, their general health, the last thing that we look at is their biochemical health. So we actually can do lab work on our patients. We can do a very in-depth profile, or we can do a general chemistry. And we do this through a company called LabCorp or Boston Heart Labs. And the key with that, guys, is if you can measure it, you can manage it. And their doctors are measuring their lab work, right? They're looking at their cholesterol, and they're looking at their blood sugar, and they're looking at their inflamed. But what are they doing? They're putting people on drugs to try to control their biology or their physiology. Well, we're chiropractors. We don't use drugs. We're DC, doctor of cause. We get to the underlying cause of a person's problem, but you don't know what the problem is unless you're measuring it, right? So let's stop using symptomatology. Let's start using biology and physiology to determine what our care plan should be. And patients love this because when you start to focus on their biology and start to get their biology and physiology better, the patient gets better as well. So I'm going to be breaking this down. I think I had 3 or 4 hours with you to go over the wellness score, what type of lab tests we do, what's the functional movement screen, and then how do we use that to create better care plans that your patients will stick with. So looking forward to seeing you October 20th. This is you.